So, now we will talk about some myths in diabetes which people commonly ask in clinics. So, the first question many people ask is that diabetes can only happen to people who are overweight or obese. Why do I have diabetes? I am not overweight or obese. So, this is a it is definitely being overweight or obese is definitely a risk factor for type 2 diabetes, but not all people who have type 2 diabetes will be overweight or obese, and vice versa, not all people who are overweight or obese go on to develop type 2 diabetes. So, if you have any symptoms of diabetes and if you are in doubt, it is better to get the blood test done. The second myth which people usually ask is that I do not eat any sweet, why do I have diabetes? Once again, the risk factors, if you have risk factors for diabetes like having a strong family history of diabetes, having other health conditions or being on certain medications, that can put you at risk of diabetes. It is nothing to do with only eating sweet. One thing people tend to forget is that eating anything from the carbohydrate category of food, even if it is not sweet, can contribute towards your risk of diabetes. So, something to look into is definitely your portion sizes rather than the type of food that you are eating. Next myth which people say is that I am not allowed to eat any fruit if I am a diabetic. So, anything in moderation is okay. If you are overeating even fruit, whether it is fruit or any other food type of food, then it becomes problematic. So, if you have a healthy balanced diet, if you take at least 3 pieces of vegetable per day per meal and 1 or 2 pieces of fruit. So, the ideal recommendation by WHO for a healthy balanced diet is 5 pieces of fruit and vegetables a day. So, diabetic patients can make it more of vegetables and less of fruit per day, but still keep some fruit in the diet so that we have a balanced diet with vitamins and minerals. The next myth which commonly gets asked is that patients say I have type 2 diabetes, it is only mild, I do not have to worry about it. But it is important to keep things under control before they slip away. So, even type 2 diabetes can become problematic once you start developing complications. So, you should not allow yourself or the sugar control to go to that level that you start developing complications, and you may have serious complications which can lead to hospitalization, like kidney failure requiring dialysis, problems with amputations and problems with heart attacks and strokes. So, it is very important to not take the diabetes lightly and to control the diabetes right from day one. Another myth which commonly gets asked is that I am not allowed to eat any sweets or chocolate with diabetes, and that causes a lot of frustration in patients. Ideally, you should not eat any sweets and chocolate, but if you have very good control and in consultation with your doctor and taking medications regularly, you may occasionally have a small treat when you go for attend family functions, but it is better as long as you can control the quantity that you are eating.